Welcome to the Poise Network Train the Trainer module for the infant lumbar puncture study. This module will prepare you to train interns to perform infant lumbar punctures successfully. This module was developed by the Poise Network. The mission is to improve patient outcomes through simulation educational interventions. The apprenticeship model of resident education, or See One, Do One, Teach One, does not guarantee that residents graduate with competence. In contrast, competency-based interventions are founded on the principle that learners do not graduate the session until they have achieved their learning objectives. Interns at your center will be participating in a form of competency-based education for infant LPs, and you will be facilitating the learning process. Prior to arrival, interns will view a procedural training video outlining the steps in the infant LP procedure. Then, towards the beginning of the year, they will experience a hands-on learning session using a simulator with you as the facilitator. Finally, prior to any clinical encounter, the intern will have a just-in-time refresher training on the simulator. Interns will be assessed for competency throughout this training experience, and clinical performance will be collected. The Mastery Training session is a one-on-one direct coaching session between you and the learner. This session is competency-based with the goal to achieve mastery of all components of the infant LP before the session ends. Your goal for Mastery Training is to custom tailor your teaching to address the learner's specific needs and deficiencies. Mastery Training has 4 phases. In the first phase, expert modeling, you as the trainer will demonstrate what is expected of the learner. Formative evaluation is the second phase in which the learner then demonstrates their lumbar puncture ability. Here you will note their deficiencies that need practice. The third phase is deliberate practice. In this phase you will facilitate the learner's practice of each component that posed problems in formative evaluation. The fourth phase is mastery performance, also known as summative evaluation. The learner will then demonstrate the entire procedure having practiced the components. Expert modeling should only take 1 minute. It is a quick demonstration of the complete procedure without actual teaching. Lidocaine cannot be used on the LP simulator, but you can use an empty syringe to simulate this step. Assessing the needs of the learner first requires you to observe the learner performing an infant LP from start to finish. An LP mastery checklist is provided for you to discern the various required components. Use the checklist to document the learner's competencies and deficiencies. Check marks in the first column designate that the component was done independently and correctly. Check marks in the second column indicate that a component was performed incorrectly, was omitted, or required any help. During this initial observation, the learner may ask for reassurance or actual questions. Feel free to answer any of their questions verbally, but for the initial observation, you should refrain from taking over or physically manipulating the simulator or needle, so that the learner has an opportunity to work through the entire procedure on their own before you provide more coaching. Here's an example of a learner at a master training session. See if you can fill out the checklist for this learner.
There's a lot of sheets. Which is the first sheet again?
So you can use, we usually use the blue drape to go underneath the mannequin. So typically the holder will rotate the child, the infant, a little bit. There you go. Okay.
And then how much do I just do that little bit right there?
No, you start in the center and do concentric circles until you work all the way to the iliac crest. There you go.
Okay.
And that's good. So everything here, you can put that away. Yeah, everything there is sterile. And once you get the site sterile, then you can use your sterile gloves to find your landmarks. Correct. Just repeat it 3 times.
Okay.
Perfect. Good job.
Okay. And then this other blue sheet goes anywhere?
You can set that one aside.
Okay.
That's an extra. There you go.
Okay.
Great. Now everything's sterile, and you can feel for your landmarks.
Okay.
Show me where you would insert the needle.
Is that the superior iliac right there where I'm feeling?
Let me just feel underneath.
Right there. Okay. And the intervertebrals easier. Right there.
You feel the difference between the bone and the two spinous processes and the space in the middle?
I think so.
Okay.
Do I have to numb it up?
He's allergic to lidocaine, this baby.
Oh, okay.
Okay.
So, fortunately, the nurses you typically put Emla on the backs of all the babies.
Okay.
So that acts as good numbing medication as well.
Okay.
Alright, so how are you gonna insert it? Yep.
And like that? Okay.
Perpendicular to the skin.
Okay.
And how about your angle?
I don't know. I think it's okay.
Maybe
Am
angle
I supposed to feel something or that way?
maybe angle it towards the umbilicus a little bit. Yeah, 45 degrees to the head, towards the head.
Okay.
There you go. That looks good.
Okay.
Now nice and smooth, nice and easy.
There.
Alright, you can take the stylet out and see if you've gone in far enough. You should get a good rush of fluid. Okay. Maybe just advance it.
Put the needle back in?
You could do it either way, whatever you feel more comfortable. Okay. And just advance it slightly.
A little bit?
And keep checking.
Okay.
You can try to, remember, point towards the head a little bit, 45 degrees, and advance it slightly. There you go. What are you feeling? Are you feeling any bony resistance or anything like that?
No, I don't know.
Okay, why don't you check?
I'm not gonna poke anything in there. I don't have anything.
Alright, so at this point it seems like you're having a little bit of trouble with the needle insertion, so let's start over. Why don't you pull the needle out?
Okay.
Sure. And you pretend to hold pressure. Good.
Here's an
Okay, so I
example
wash
of
my
another
hands,
of another way.
I put my
You can
gloves
fill out
on,
the checklist for
sterile
this.
gloves, and I'm just going to clean off the baby to make as sterile a field as we can. Round circles, clean the top, so that part is sterile too. And I'm going to do this 3 times. circles. Okay. And I'm gonna just put this stuff shits down. Thank you. And on the top as well. Okay. And I'm gonna just wipe off the back and let it dry for a little bit. And I'm gonna go ahead and put my stylet in, see if I can get the fluid. Just feel my landmark again. I'm gonna go in, double up, point it to the umbilicus. And, oh, yay, I got fluid.
Excellent.
Okay. Oh, oops, I forgot to open these up.
Yeah.
That would have been helpful.
Yeah, just so the next time, just, if there's someone that can help you,
Okay.
have them set up or preset them up. But you did great.
The final phase of mastery training requires the learner to correct each component that was not done correctly. This is called formative evaluation. For example, this learner inserted the LP needle at an incorrect angle. Ask the learner to reflect on the components and whether anything needed revision. You may have to tell the learner of the deficiencies if it is unclear. Then you may discuss, demonstrate, or coach the correct method for this particular component. Then the learner should practice performing the component, the LP needle insertion, independently. The learner should now have mastery of this component. Each component done incorrectly, omitted, or required help should repeat this cycle. Once all components have been addressed, it is now time for the summative evaluation. The learner should then demonstrate the entire LP procedure from start to finish independently without assistance. We encourage repetitive, deliberate practice until the learner feels comfortable with the entire procedure. The principle of deliberate practice is to perform a task multiple times, and the repetition itself assists in working towards mastery. Indicate if mastery was achieved with a checkmark here. You should readdress any components that posed further problems. And not everyone will achieve mastery in the time allotted for your training. If you feel your learner will require more practice to be able to perform independently, please notify your site director, and they can arrange for more hands-on training in the future.